if you would be so kind as to share cancer care, cardiac care, and surgery, and how we've seen those grow, and how we're addressing a real need that was in the community, and are actually even expanding the cancer center as we speak.
So we use a medical staff development committee that helps us guide. It's made up of physicians, board, and community members. And we do a third-party analysis of how many physicians of what specialty. And it really have been working with and partnering with Carolina Regional Ortho as an example, Boyce Willis, in how we deliver care and starting those dialogues about what's right for the community, what also benefits the practice and benefits the hospital, but that we need to take on as a partnership. And sometimes when business gets tight, those conversations just kind of lose their focus because we all go back to our own corner and it's just easier. But the medical staff, Boyce Willis, CRO as examples, have been really good partners that come into the table with us in helping develop that. And through those partnerships, cancer care being one of those examples where we worked with Boyce Willis, we worked with Dr. Crocker and his group to bring cancer care into a single facility so that we could get economies of scale and work together. Cardiology is another example. We worked with Boyce Willis to help consolidate that, bring it into one practice. We have sites at all campuses, their medical office building, and provide services. And I think we're doing a better job for the community. We're able to consolidate. There's not confusion on the patient side, the physician side, and the staff side. And so I've seen tremendous growth in not only the volume and the services, but the quality. And so we certainly invite, the board has been very explicit with me about having third parties come in and evaluate us on how we're doing. The American Heart Association, the Stroke Association, American College of Cardiology are just some examples. Gene, you mentioned Leapfrog, certainly, which is for those viewers that aren't familiar with Leapfrog, it's a national not-for-profit organization. They call themselves a watchdog for American hospitals. And just as you mentioned, they give us a letter grade, just like we got in school, A through F. And certainly, just like in school, A's are better, and as you go down, right?
But they generally rate every single hospital.
They do rate every single hospital.
Right.
And so
there you go. There's the A.
Yeah, so across the country. And there are a set number of parameters that they use. They change those periodically, but let us know what those changes are going to be. You chair the Equality Leadership Council, and you know that we talk a lot about and focus on how to respond to those measures. And so a lot of partnership with our medical staff, a lot of partnership with our staff and our board. And so to your point, in the last 3 report periods, which equals a year and a half, we've received an A, which only about 20% of the hospitals in the country receive an A. And so we're very proud of the work and that we have been able to make and realize. CMS rates us. We've been making improvements there. We've CMS.
You would tell what that is.
Yes, Medicare, Medicaid,
Okay.
Centers for Medicare Services, which oversees all hospitals who accept Medicare and Medicaid patients, which is in essence every hospital.
Right.
And they rate us on STAR systems. We made improvements there. They also either incentivize us with payments or hold payments back if we don't meet certain criteria. And we have been able to enhance over the last couple of years because of our performance with those measures. We've improved the reimbursement from Medicare and Medicaid by about $650,000 because of our quality improvements.
So delivering a better job gives us more money
That's
to
right.
do further improvements.
That's right. So-
Perfect
So,
incentive.
and then one of the things that we've just invested in over the last year during the pandemic that the board was very passionate about is the patient and family experience. And so we brought in a whole new team of patient engagement navigators. They are in the hospital 24/7. And they help work with our patients, their families, to make sure that we're coordinating care, we're communicating. And so it's, sometimes for us in healthcare, the forest and the trees, we're busy, the physician's taking care of multiple patients at one time, the office, there in the hospital. And these individuals help bridge that communication with the patients and the physicians, the providers, to make sure we're getting the information that they need to be successful as patients and make sure that we're focused on them.
And I want to give a testimonial there. I was just at the breast center for my annual mammogram, and my husband had surgery with Dr. Perlmutter. When I get those surveys, I really want to do my part to praise the staff, because I know they work so hard, and I'm working in the hospital on the board seeing that, and so I just give them the top scores across the board, just so that's kind of my way as a member of the community to say thank you.
Right, and not only do you do so because you're a member of the healthcare system, but they've
But it's
earned
true,
it.
they've
But
earned
it's
it.
absolutely true.
Yeah.
I see on a daily basis, on the floor and in the operating room and in the associated departments around it, people going out of their way, co-workers going out of their way to deliver an A-plus job. And if you interact with 10 people and they all contribute 10% to your care, and 3 of them fall flat, you end up with a 70, which is a D in any grade book.
Right.
Right? So everybody really has to step up to the plate to deliver that A, and everybody does.
Oh, they do.
They really do.
I know. It's very genuine when I said, I didn't have to wait very long. They were very nice. Everybody asked if they could help. I just can't say
Well,
I couldn't
and-
have had better care.
One of the
They don't know
one
I'm
of
on the
the
board,
unique
so that's not part
features
of it.
of the CMS patient survey that you were referencing is that they asked for the overall rating of the hospital. It's on a 0 to 10 scale. And I tell people that by nature, I'm an 8 kind of guy, right? Because 8's good, but it means that you can still have a little room for improvement, but I was really happy with the service. In the definitions of Medicare and Medicaid, an 8 is the same as a 0, so they only count 9s and 10s. And
Did
so,
you know that, Dr. Perlmutter?
I did not know that.
Yeah, I mean, you got to get a 9 or a 10, or an 8 is like a 0. So that's why I'm glad we brought that up, because I get 10 service when I go to the hospital, and it's not because they know I'm on the board, because they don't. I'm right there with a mask with everybody else. But people could not. I can tell that they are all doing the best job they can.
So if somebody
with
rates a
patient care.
hospital a 4 or an 8, it's functionally the same rating.
it is, for as far as
CMS.
CMS is concerned, Medicare, Medicaid, it's the same. Now, we know the difference
We
and can
do.
separate that out a little bit.
But the point that I'm trying to make, though, is for you to have metrics that show significant gains, that means that we're getting rated
That's right.
9s and 10s.
That is correct. So several years ago, we were in the 9th percentile for patient experience. That meant that 91% of the hospitals across the country were doing better than we were.
Wow.
We are now, and Gene has been helping us keep focus on this. We're now in the 60th to 66th percentile, which means that we have improved. The board has tasked me with getting us to the 75th percentile, meaning that of all the hospitals across the country, we're doing better than 75% of them, or in the top quartile. And that's where we're aiming to go. But in the 3 years that we've been really focused on this, that is a tremendous improvement. And it really is a testament to the staff's work, the partnership of the medical staff, and the board's vision of continuing to be insistent on what they want us to do for the community.
Right, and a lot of that, of course, is community perception. And a lot of that is what the hospital does for the community outside of the campus.
Correct.